Hey, thanks for joining us. This is Tamara Hill from Pacific Roots. I'm the CEO, and Dr. Charity Hill. You want to say hi, Dr. Hill?
Hi, everyone. Thanks for coming.
All right. So we have the chat for any questions that you might have, but I know that your time is valuable and this is a great topic. And so we want to just respect your time and get moving. So really the question we want to ask today is, can CBD suppositories or CBD in general be helpful for pelvic pain patients? And Dr. Hill, who happens to be my sister, she and I have been working on the formulations that we have for our suppositories for a while. Charity, can you give a brief background about you?
Absolutely. So I am a physiatrist, which is a physical medicine and rehabilitation physician, and I work in pain management. And for a while, specifically, only worked with pelvic pain. I was inspired to do so with my own journey with pelvic pain and endometriosis, and became really passionate about trying to serve this underserved community in the medical world, which really affects 1 in 10 women and probably 1 in 8 men, though it's underreported, underdiagnosed. So that's how I ended up doing what I do. And that's about it.
Nice. So how did you come upon CBD? Well, by the way, this is the cute little biography about Charity, but oh no, it's going to go to it. Let me get out of that real quick. Let's get back to our sweet PowerPoint. There we go. So when you were treating pelvic pain patients, you started to use CBD as an alternative to Valium. So talk about
Absolutely.
that.
So the gold standard when I began working in pelvic pain was, of course, the Valium suppositories, addition to pelvic PT. That's like if you were lucky enough to find someone who would do Valium suppositories. In the midst of my practice, the FDA came up with kind of stricter regulations with controlled substances where people were needing to get new prescriptions more frequently, and different state by state regulations on how to get those controlled substances prescribed. So something that became difficult for patients to get became almost impossible. And especially during COVID, when it became difficult to see patients at all or have them even come in for physical therapy, I leaned more on CBD suppositories, which I had already been dabbling in, and realized in doing that the efficacy was as good as Valium suppositories, and you could bypass all of the difficulties of dealing with the controlled substances. And also people who got drug tested preferred this over having the benzodiazepines in their system.
Yeah, absolutely. And then you had learned about the CBD suppositories at a IPPS conference, right?
Yeah, I saw a presentation which intrigued me greatly, given my own journey with endometriosis and chronic pelvic pain, on suppositories used vaginally up against the cervix for dysmenorrhea, and how successful it was. And in it, it's interesting because they presented this but never published it due to, you know, conflicts with publishing any data about CBD. And so I'm glad I saw the presentation and began using it on myself and in my patients with awesome success for dysmenorrhea, and just kept expanding the use from there.
Great. And we'll definitely touch on that a little bit later as well. Cool. Thank you for that. All right. So for those who don't know, what is CBD? CBD is one of the cannabinoids in the hemp or cannabis plant, or even a marijuana plant. So this is a cute little hemp cannabis plant. And by looking at it, you cannot tell whether it is CBD or marijuana. You can't smell it and tell the difference. You can't do anything. Actually, there was a funny story when we used to deal with bulk flower. I had a sample that we were sending to a client for testing, and it got confiscated by the Orlando PD. And we literally had a reverse drug exchange in a parking lot because he's like, hey, you have all this paperwork. I can't tell. I don't want to send it for testing. So yeah, have it back. It was so funny, but there's no way to tell what this plant is until you get it sent for testing. And so really the legal definition of hemp here in the United States is that the plant, this plant that you see here, has less than 0.3% THC. And the THC that they calculate is the combination of delta 9 THC and THCA. And those are two of the variant forms of THC. There are more, but when they came up with the legal definition, those were the two predominant ones that creates the high feeling. So in other countries, it's 0.2%, but here in the United States, that's the definition and the difference between marijuana and hemp. So is hemp legal? Yes. So CBD became legal under the 2018 US Farm Bill because CBD does not make anybody high, but it's the THC that does. Now, having said that, there are some states that have legislated further, but as of right now, federally speaking, everything that we manufacture is legal. But definitely check your states if there's any question about that. All right, so CBD, as I mentioned before, is one of the cannabinoids in the cannabis plant, and there are 80 to 100 different cannabinoids, and THC and CBD probably being the most well-known. However, CBD has no psychoactive effects that THC is commonly and famously known for. CBD has been known to help with chronic pain, inflammation, sleep, anxiety, and relaxation. However, having said all of that, we cannot make these claims about any of our products. These are kind of the generally known as, but nowhere on our labels will you see us say that CBD can do any of these things. Now, so what is THC? Because Pacific Roots does contain products that do contain THC at or below the legal limit. There's many different cannabinoids, delta 9 THC, delta 8, delta 10. Delta 8 has come onto the market a lot. You'll see that, especially in smoke shops and vape shops. It's a loophole that some very entrepreneurial pro-cannabis people were able to take actually CBD isolate, put it through a series of chemical pathways and turn something harmless into something that makes you high. And legally, there's a lot of issues with it because it's not mentioned under the Farm Bill. And so the DEA and FDA can't really do anything about it because it's not in there, but you'll see a lot in the news about it. THCV, which they believe is actually the suppressant to appetite. So that is a very up and coming cannabinoid. You can definitely be on the lookout for that, which is kind of interesting because most people think THC will give you the munchies, but like our body's homeostasis for everything, that there's a yin for every yang, and that's what they believe THCV is. And of course, more variants are getting discovered or created as our creative hemp chemists have come up with. So how do we get CBD from hemp? So we have that plant that I showed you earlier, the cannabis plant, and it goes through an extraction process. So you start with the raw biomass, they'll chew up the plant, and then they'll just start pressing it for oil. And then that first pass that comes out is the crude oil, and it's literally just, it looks almost like tar. And then from that crude oil, it becomes refined into full spectrum oil, broad spectrum, or it will become an isolate. So the full spectrum contains THC along with other cannabinoids like CBD, CBG, CBN, on and on and on and on. And broad spectrum will contain those same cannabinoids, but it has the THC removed. So a broad spectrum oil will not have any of the psychoactive effects associated with THC. And then isolates are literally just refined CBD and CBD only. Nothing else will be in that combination. So as people are choosing what CBD products to pick from, these three, full spectrum, broad spectrum, and isolate, is really important to look at. Because if you are somebody who is a first responder or has to go through mandatory drug testing, you're going to want to find a product that does not contain THC, which means you're going to want a broad spectrum or an isolate product. Now, having said that, full spectrum products tend to work better. There's an entourage effect that happens when you have all of those cannabinoids in the product that have just a better, more potent efficacy. Have you found that for your patients as well, Dr. Hill?
I not only found that my patients, but myself. I always thought like, oh, I just don't respond to CBD. I'm one of the non-responders, until I tried a full spectrum, and it's amazing what like 0.2% THC can do. You don't feel high at all. It's just, it like almost activates the CBD and makes it work
Exactly.
better. So if you have a non-responder and they haven't tried full spectrum, that should be the next step.
You know, I was just looking through some of our reviews on our website, and there was somebody who had tried the isolate, and they're like, I have to take like 2 of them. I'm going to try the full spectrum. And then I found their same review of the full spectrum, and they're like, these are amazing. And I'm like, oh, there you go. There's just something about the activation effect. All right. So do you need a prescription for CBD? Absolutely no. Nobody needs one. I think the reason why your patients were getting them from you is because at the time, these products like CBD suppositories weren't available, and you had to have them specially compounded at a pharmacy, right?
Yeah, they weren't available commercially. We found a compounding pharmacy who's willing to do it for us, essentially, and did it as a favor.
Yeah. But the great thing is now they're commercially available, and you don't need a script for any of these. So, all right. So is CBD a cure? We would never make that claim, but what I like to tell practitioners is that this is another tool in your tool belt. There's a lot of different ways to treat pelvic pain and in any condition by any means, but this seems to be a very effective tool. I've seen about 70% efficacy. I think I'm being conservatively low on that, but Charity, what did you see with your patients?
I would say about 70%, which is actually around the same that I saw from a Valium suppository.
Yeah. Oh, interesting. And I got a question about men versus women here. I've seen that a lot of our clients, our customers purchasing, are men, but talk to me about men versus women and how
it probably works even better in men. And some of that is that a lot of women use it vaginally. Vaginally, there's less systemic absorption. And so you're going to have a more localized effect and won't get the general effect as well. When used rectally in women, I see equivalent success as men, which is probably higher than 70%, honestly. But I think that's the biggest difference is the mode that you're using it. When I have women with really severe menstrual pain, as well as other like gastrointestinal or other just severe generalized pain, either from endometriosis or other autoimmune disease, I'll sometimes have them use one vaginally and one rectally at the same time when they're in like a pain crisis.
Hit it hard.
Exactly.
Great. All right. So you and I had discussed these before, but what are some of the indicators that you've had recommended these to patients for? So you want to talk about those really quick for us?
Awesome. For men, rectal pain, so-called chronic prostatitis, testicular penile pain, even pain from inguinal hernias or hip pathology would work really well. Lumbar pathology for women, you've got the chronic pelvic pain syndrome, levator ani, coccydynia. It's going to work really well, again, in our endometriosis cohort, or even with people with just dysmenorrhea or just pain with intercourse. And then one thing we saw kind of unexpectedly great success with was with IBS, both constipation and diarrhea versions. It works really well when used rectally for IBS symptoms, just kind of decreasing those smooth muscle contractions in the bowels, decreasing bloating and intestinal discomfort. And so that was a really nice thing to find, a nice tool in our toolkit for that.
And then just one thing I don't have on here is necessarily bladder pain. What kind of does this help with any urinary symptoms or bladder pain?
So that is an awesome question. If you're having bladder pain syndrome or even urgency and frequency, this should help. One thing it will definitely not help with is like something like a prolapse, like a non-painful, a weakness. It's not going to help with weakness. With pain, it will definitely help and even may decrease some of those urgency and frequency symptoms.
Gotcha. And of all of these conditions, do you see kind of a common thread of all of these? Are these more smooth muscle things? Are these just
That's an awesome question. I definitely think with all these things that kind of get lumped into chronic pelvic pain syndrome, there's what we call neurogenic inflammation, where essentially there's this cycle where the muscles are in spasm, the nerves get less blood flow, become almost like acidic, and the nerves themselves begin originating their own inflammation, which is called neurogenic inflammation. And it just is this unending cycle of nerve inflammation, nerve pain, which triggers the muscle spasm, and it just goes in this never-ending feedback loop. And that's where this is so helpful, because we have the magnesium there, which is a natural muscle relaxer, so that helps with the muscle side. And then the CBD helps with the neurogenic, both the inflammation as well as the nerve pain itself. So it's kind of working in 3 different ways to help break down this cycle.
Great. And I'm actually getting a question about dosage for different conditions, but let's address that a little bit later when we talk about dosaging in general. So those people who want to know, hold on, it's coming. All right, so we at Pacific Roots have 4 different types of suppositories that we had come up with. These are all made with a cocoa butter base, and as Dr. Hill mentioned before, they all contain magnesium, and that magnesium is amazing, as she mentioned, for muscle relaxation, and just what else, Charity? If you're going to say, and magnesium,
so we do
the
cocoa butter base. It's not necessarily the best base for temperatures and things like that. The nice thing is it's safe for people with vulvodynia, clitoral pearls, lichen sclerosis. This is like the most benign base that we could possibly work with, and so that's why we're using that.
Yeah, and it does melt quickly, so that's why we recommend, and on the box it'll say keep stored in the refrigerator or even in the freezer. Just don't forget that you have them. So one doctor told me I sent him some samples and they put it in the freezer and forgot all about it. And I'm like, what? So, but we do have 4 different types, all contain cocoa butter and magnesium. And the first one is the yellow box, which is the Wellness Daily. This is made with an isolate. That means it contains no THC. So this is great for people that are first responders. Or they might be concerned about THC in general, or they are THC sensitive and don't want to feel high or worried about that. That's a great place to start. Then the blue box is our Wellness Plus. This contains 100 milligrams of full spectrum CBD, and this is our strongest dose that we have. This is our bestseller, hands down, like 2 to 1. It outsells everything. It's very effective. Again, doctors, you can check out the reviews from verified people who are using it about how it has helped them. And then the next one is the Pleasure line. This is a little bit less of a dose than the Wellness Plus. And in reality, there's not a whole lot of difference between these 2 suppositories, other than the fact that the Pleasure, it's just honestly marketing. The Pleasure is a 5-pack. And most people dealing with severe chronic and pelvic pain are not thinking about sex. They're just thinking about not being in pain. But not only do these suppositories help with pain, but they definitely, because of the relaxation effect, can enhance sex. And you'll see a lot of that on the website as well. But if you also have somebody who's concerned, like they don't want to put in the investment for a 10 or a 30 pack for the Wellness Plus, they can start with the Pleasure, and it's just, again, only has 25 milligrams of CBD less than the plus, but they can start at a 5 count, and that's less than $30 to try it and move on. And then our last is the vaginal moisturizer, and I love this product. It's our newest product. It contains hyaluronic acid. It also has isolates. There's no THC in it, but we also have aloe and a mix of vitamin A and E. So really a great nourishing effect for anyone who's experiencing dryness, usually related to either menopause, postmenopausal, or they might be going through chemotherapy. Right, Dr. Hill?
Absolutely. And it's really a nice alternative to, just because there's so many concerns, especially if there's a cancer history in that patient, about estradiol, estrogen creams and things like that. And so this is a nice thing to try.
Actually, that
very
was one of the
benign and
questions
safe.
that popped in was,
Oh, good.
how would you use this with an estradiol cream, or what did you have a preference? What would you
So
recommend?
you can definitely, especially if there's a contraindication to estradiol, you can use this instead of or in addition to.
Oh, cool. Good to know. All right. So here's the guide to selecting a suppository, because people are like, there's 4. I don't know where to start. So the first question is the best way to separate these out is, do you want THC or do you not want THC? And from there, you can it helps you pick your pathway there. If you have the THC is okay, it's the wellness plus or the pleasure. And at that point, do you want a 10, 30 count or just a 5 count? And then for the no THC, the dryness or the regular. So that helps really break it down.
And would this be a good time for me to talk about the dosing? Oh, we're going into
not yet.
here.
Not yet. We'll
Okay.
definitely have some time for dosing. I have a slide
Okay.
for, so here again is our wellness daily. I kind of talked about these already as far as for those who want to avoid THC. And we do sell them in a 30 count. And so a lot of what, and we can, I guess, mention this here, but you recommended that your patients take these daily, if not twice daily, depending on their issues.
Yeah, depending on the kind of acuity of the situation, where they are in their course of their rehabilitation or disease process. So if someone's calling you a lot, if they're really going out and seeking care in the middle of a physical therapy program, it should be taken once or twice daily. And the milligrams, honestly, if they're in that severe pain, I typically hit hard and heavy first. And so I do the top dose first, once or twice a day, whatever ends up working for them to get rid of their pain. And like I said, if it's really severe endometriosis, or someone's the type that's going to the emergency room with cramps every month, one vaginally, one rectally, up to twice a day. It's amazing that it can really take the place of opioids, or again, even like prevent people having to use emergency services to get control of that severe pain. And so those are when I use the high doses. Typically that's a course of 4 to 6 weeks, where you're once or twice a day, top dose, doing your physical therapy, undergoing workup to get to all the underlying causes. And once that cycle is broken that I was talking about with the neurogenic inflammation and muscle spasm, then you can just come down. If you're, twice a day, come down to once a day again for 6 weeks. If you're once a day, go down to a half of a suppository once a day for 6 weeks, and really just eventually slowly taper off. Some people with chronic conditions, chronic illnesses, endometriosis, adenomyosis, or like hernias that you haven't gotten surgery on or things like that, they may need daily. But most people end up being able to use it as needed eventually, which is really lovely. And they even have the 5 count, which I call the period pack, for people who just have bad periods and need those 5 days a month where they have that support. But our goal is really to rehabilitate people and get them better.
Get them
and then
off
we're
of our
just kind of the
products.
backup.
Yeah.
Mhm.
And that's why we like to tell, this is just another tool in the tool belt of providers. And then hopefully once they're out of pain, they can just enjoy the pleasure. pack, right? So, yeah, we kind of talked about these. Dr. Hill mentioned these. These are just a little bit more detailed on each one of them. So rectal versus vaginal use. I think, Dr. Hill, you've addressed this really well as far as the vaginal really is for more localized effect versus rectal, which will go systemic. And interestingly enough, some of the studies we'll refer to later talk about inhalation, and there's different ways you can take CBD. Obviously, you can smoke it just like somebody would smoke anything, or regular marijuana, but smoking CBD is the best way to get it into your system. Health-wise, it's not what I would recommend, just because now you have potential damage to the lungs. But after inhalation, the next best way is to use a rectal suppository. And then after that, it's sublingual, and then edible, like our gummies, and the sublingual would be like our tinctures. And then, like, probably the worst way is just the topical skin way. But those are the different ways to get it into the system. But the rectal suppository will be very effective. How about safe for cancer patients? I get this often from providers.
Yeah, it's absolutely safe to use in combination with whatever medication the oncologist recommends. I would just let them know what you're using so they're aware of it. Most are really comfortable with CBD products being used in combination. It's just, of course, not going to supplant or replace any cancer treatments that are recommended by your oncologist, but it can be a nice adjunct.
Yeah. Oh, great. And then how often can patients use this? And I think you kind of mentioned it, that it might be once or twice a day. And then hopefully it can be reduced to as needed, right?
Have I had people use it 4 times a day? Absolutely. They don't have side effects. You still won't have any psychoactive effects. It's usually not needed or required to take it that frequently, but it can be safely used 4 times a day.
Yeah, and then just from us being conservative, I always tell people, like, if you're really worried about the psychoactive effects, try half a suppository first and you can build up. But for the most part, it's very rare that that's going to happen. All right. I always get this question from doctors, and for chin scratchers out there, are there any FDA studies? And I had a great conversation with a Dr. Goldstein out of San Diego, and he was telling me at a recent conference at Ishwish that he thought he would do a self-funded study, had his graduate student put together a proposal to submit to the FDA. The next thing he knows, she tells him, "Hey, we've got a call with the FDA." He gets on this call, and he was literally like, it would have taken an act of God to get all of the different heads of every department from the FDA to get on a phone call. And they were all on this phone call. And they're like, "Yeah, we want you to do a study, and we want you to do this, this, and this, and we want to do animal trials." And he's like, "This would have cost me $7 million. And so we quickly said, "It's okay, we'll withdraw the study." And so at the end of the day, there's not going to be any CBD company that's going to put up a $7 million animal trial study for something that can't be patented. And I think the FDA knows that. So really, we're not going to get any official FDA studies. However, there are a lot of non-FDA studies out there. I've linked a couple of these, and if when we post it online, I'll make sure that links are active for people to get. But the use of cannabis for self-management of chronic pain, effects of cannabis ingestion on endometriosis associated with pelvic pain and related symptoms. In this last one, number 3, cannabinoids and chronic pelvic pain in women, focus on endometriosis. So these are, one of them is a Canadian study, and some others are just more self-reported. So it doesn't have all of the normal FDA study trials. But I want to focus on number 3 here. And this is the abstract from this. And it says, Chronic pelvic pain in women is common and frequently difficult to treat, and chronic pelvic pain often develops in the settings of endometriosis, interstitial cystic bladder pain syndrome, and vulvodynia. And this was great. Cannabinoids are a promising treatment modality for non-cancer chronic pain. And then it continues, in the opinion of the authors of this study, cannabinoids are a reasonable treatment modality for refractory chronic pelvic pain, especially if neuropathic component is suspected. And Cherry, I believe you even said that, right?
Yeah, and they're all neuropathic, all of them.
Yeah, and practitioners should expect a modest pain effect with acceptable safety profile. And that's great, because I think a lot of the FDA is like, this isn't safe. Because, and actually, this is a great place to insert this question about pregnancy and breastfeeding, because that's one of the biggest warnings that we have to put on all of our packaging is regarding pregnancy and breastfeeding. So do you want to address that from what you know about it?
Absolutely. And I went through this with a fine tooth comb before I got pregnant the first time, because I was like, am I going to be able to use this? Everything I could find about hemp and pregnancy, there was not much, first of all. And most of it, what I could find, showed that maybe harmful effects from use of THC during pregnancy, and maybe beneficial, but doesn't seem to be harmful effects from CBD during pregnancy. But again, no one could really make any determination. I myself opted to not use during pregnancy or nursing, just due to lack of data. Yeah. And that's generally what I recommend to my patients. Like, play it safe. Are there women out there smoking pot during their pregnancy and nursing? Absolutely. Don't recommend it. And even the CBD, even though it's most likely safe, and some studies argue that it's beneficial, I would still recommend abstaining during those periods of time.
Especially THC, maybe just
especially with any THC. Yeah, I would definitely avoid any THC. THC actually stays in breast milk for like well over a week. So it's not like you can even pump and dump. So yeah, just generally play it safe with that. If you have someone who's, for whatever reason, not breastfeeding, or has had any other abdominal surgery, it is awesome for post-operative pain, for post C-section, again, if they have opted not to nurse, or any other kind of obstetrical or abdominal surgery. It works really well for pain management.
Great. All right. Oh, and then here's some more of our anecdotal data from some of our customers. I just plucked a few off our website. I appreciate their telling us they're the best suppositories they found, and Dr. Hill, I don't even know how to say this.
The pudendal nerve. Yeah, a lot of people with pelvic pain are diagnosed with the pudendal neuralgia. It's probably honestly just a part of what they're dealing with, but I'm glad people are at least getting a diagnosis. Definitely part of that neurogenic inflammation that we're talking about. And I would expect someone with a diagnosis of pudendal neuralgia to do really well on these suppositories.
Yeah, and they seem to have appreciated it. So, and then here's another one. This one who somebody who had ulcerative colitis, and again, we can never say that this is a treatment for these conditions, but these are people that have found a lot of comfort. In this particular client, just appreciates the natural versus a pharmaceutical approach to the healing process.
Yeah, and that's interesting. I haven't had a lot of UC patients in my practice, just because it doesn't, automatically trigger that pelvic pain response in the same way. But it's interesting that it had that crossover, like I've seen with the IBS patients, and helping so much with the bowel discomfort and inflammation. So it's interesting to see that it's crossing over to the autoimmune bowel disorders as well.
Wow. And then this is somebody who's at a game changer, and it's just great to see that these people are finding relief, and that we can help provide that for them. And these are just the wellness daily. So these are the THC free. This is somebody who, I love that the relief was pretty immediate. And we see that for a lot of people that it can be, almost within minutes, they're feeling relief. And some people don't feel it right away. But I think with that breaking the cycle you're talking about, some people might take a little bit longer to experience that, especially if they continue using it regularly, that eventually that will help with the chronic inflammation.
Absolutely. And I would say it works best in combination with a physical therapist who's preferably doing internal mobilizations, really trying to, stretch the fascia and adhesions in the pelvic floor muscles to really get it to release. In addition, this really helps their work because there's a little muscle relaxer in it, and it's desensitizing them by decreasing their pain before the PT goes and works. So it's really a nice synergy between pelvic floor physical therapy and this medication.
Yeah, and I've had a lot of pelvic floor PTs tell me that they have their patients take it before and after, and it's really helped them reduce the pain, like the recovery time after PT too, which is great. So what sets our products apart? Because there are other CBD suppository companies out there. Our suppositories are the only ones that contain magnesium. This is our silver bullet, and this has this it's kind of a synergistic relationship with CBD also to help with the relaxation, and then kind of hit it with the muscle and the nerves at the same time. And of course, we have physician oversight with our very own Dr. Hill, and we use pharma grade products. So a lot of CBD companies, people are worried that, and I actually even had somebody tell me they were making their own CBD suppositories like in their kitchen, and I got really scared for them. Everything we do is top-notch quality, and you can see all of our reports on our website. And a lot of CBD companies out there will only do what's called a potency test on their products, but we do a full panel, which also tests for heavy metals, any lead, microbials, the whole 9 yards. So be rest assured that you're getting a really clean and safe and effective product. Side effects. I'll go through these pretty quick, but other than we don't get much complaints other than maybe getting a little bit sleepy. And some people that are really THC sensitive could say they felt high, but it's very rare. We do have some people that are magnesium sensitive, and you can actually sometimes see the magnesium in our suppositories. They kind of precipitate out a little bit because they're water-based and the suppositories themselves are oil. But in rare cases, people will get irritated by the magnesium. If this is the case, just rinse the area really well, coat it with the water-based lube, and this seems to really help any side effects with that. But so how do we work with providers? We can help you with some discount codes. We have an affiliate program and our wholesale program, and I will make sure I email all the providers this as well. And any other questions? I've got a couple of questions left, Charity. We got about a minute, but one of the questions I got are there any contraindications or negative side effects with other medications?
No, only contraindication I could think of is someone who has known THC sensitivity or really feels like they've had a bad reaction and they want to avoid it. I would do the CBD only. Other things you can use is some people aren't, because they're in so much pain and so sensitive that they're not physically able to insert it. And then we have a lubricant, which you can use topically, as well as edibles that they could use to try to get some systemic benefit. And that can help in the meantime until they get more comfortable with the insertion. But as far as medication side effects, there's no contraindication with any medications people are taking. So it should be safe to use with anything out there.
Great. Well, thank you. Thank you so much. And then the other question I had was, do you have to take it forever? But I think you already answered that. It's hopefully we can wean you off and you can take it as needed. And
and there's no withdrawal symptoms. You're not gonna have to wean off it in the way that an opioid would. It's just you're weaning off of it because you're improving, you
Yeah.
know?
Oh, absolutely.